Hey Fred, I'm Tim Murphy from southwestern Pennsylvania, 18th Congressional District. This process I'm dealing with mental health reform really began immediately after the terrible tragedy in Newtown, Connecticut at Sandy Hook Elementary School. I have kept in my office since then the photographs of children who tragically died that day. But it reminds us not only things that happen in Connecticut, but really every state of the Union has seen more than their share of tragedies occur from untreated mental illness. 60 million Americans are affected by this. That means millions of families are suffering from this. 10 million Americans have serious mental illness, and about 4 million get no treatment at all. And as we investigated this in the Oversight Investigation Subcommittee, Energy and Commerce, which I chair, and under Fred Upton's chairmanship of the committee too, we really found with two GAO reports that the federal government was a mess. It wasn't even a patchwork quilt, but 112 federal agencies that just deal ineffectively with mental illness. This changes that whole trajectory for the millions of families suffering from this. This creates a new office of Assistant Secretary of Mental Health and Substance Abuse to coordinate those agencies. This puts more accountability, more evidence-based applied research, more care, but it's very comprehensive, one that passed the House 422-2. We worked on ways of working this out with the Senate. It's there. But let me tell you one of the things as this starts to change immediately. The body count of people who die from mental illness-related problems is staggering. More people die from that than breast cancer or several other diseases. It's 959 a day. 350,000, according to Tom Insel, the former head of NIMH. And that includes the 43,000 suicides, the 47,000 drug overdose deaths, the thousands of people who may commit a homicide, the 250 or so mentally ill people who attack someone in law enforcement or as first responders and are killed. But more so, the fact that so many people with mental illness tend to die 10 to 25 years sooner because of untreated complications with other physical ailments. That's 350,000 just in 2015. That is more deaths related to primarily and secondarily to mental illness than the total U.S. combat deaths from World War I, Korea, Vietnam, Bosnia, Desert Storm, Afghanistan, and Iraq in 1 year. This changes that trend because we have worked out a compassionate, evidence-based approach to changing how we deal with this in America. And I want to thank that when Speaker Paul Ryan took the helm as Speaker, one of his first comments was, we're going to pass this. Paul Ryan, Kevin McCarthy, Steve Scalise, and Cathy McMorris Rogers, but particularly Fred Upton, they're all grabbing onto this because all of us know of tragic stories that have occurred to us. And we recognize now that this has changed and provided help for families in mental health crisis and changing the direction we have with mental health care in America. And I thank everybody for their leadership and their compassion in making this happen. Thank you.